Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks and during procedures are in extensive personal protection to keep you safe.
Begin your New Teeth Now transformation.
Good evening, everyone, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm joined here tonight virtually with Dr. Kirkpatrick. And tonight we are going to be learning all things dental implants. So we're going to go ahead and get started. How are you doing tonight, Dr. Kirkpatrick?
Hey, Bianca, I'm doing well. How are you?
I'm doing good.
It's going to be exciting. Good night.
Yes, it is.
Well, we'll go ahead and get started. So first of all, just a little bit about me so you guys kind of know who you're listening to. I'm David Kirkpatrick, and I'm currently in practice here in Lakeland, Florida. And a little bit about my background: I'm originally from Kentucky. I did all of my school at the University of Kentucky, and my surgical residency was done actually in the University of Florida in Jacksonville, and that's how I ended up here in this sunshine state of Florida. One of the things on this slide that you see that I am a board certified oral and maxillofacial surgeon. That is one of the most important things that you'll hear tonight. You want to make sure that when you come to see me, that I am board certified, which I am, or whoever is going to be treating you, that they do have their board certification. It's kind of what we use to make sure that everybody's up to the same standard level of care. So we are going to be talking a lot about implants. And let me see if I can get that to change. So dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know what an implant actually is, this is an artist's rendition of, an implant going into bone. So the implant is the screw-like structure that you see here, the gray structure, and then the ghost-like figure that you see there, that is the abutment or the post that the crown or the tooth gets cemented or screwed into. You can obviously, the gum stuff there, and then here's the bone, and the implant goes into the bone. So the implant, a lot of patients get confused on actually what the implant is. An implant is not the entire tooth connected. The implant is the root structure that goes into the bone and gives a really good support or anchor system that the bridge or the crown can get cemented or screwed to. What we do here at New Teeth Now is more like this. We don't do a lot of the single implants. We do those occasionally, but we are more focused on when someone needs an entire mouth reconstructed or entire upper jaw or lower jaw. The way we usually do this is we place 6 implants in the upper jaw, and that is what the entire bridge, 12 teeth, would get screwed into. Unlike a denture or a partial, it does not come in and out. It's screwed in, it's fixed. There's no wings that go up and underneath the gums or the lips or the cheeks, and the roof of the mouth is not covered. The lower hybrid is very similar. So we'll do anywhere from 4 to 6 implants on the lower, and that enables us to retain the entire 12-tooth bridge on the bottom. Screwed in, fixed, cannot come in and out. You brush them the same as you would natural teeth, toothbrush, toothpaste, water pick underneath, and then you go get your professional cleanings every 6 months, just like you would for your regular teeth. So tonight, we're going to be talking to and listening to actual patients that I've treated and done this procedure on, one of which is Bethany that you see here. And some of you may already know who she is by watching some of her social media stuff or YouTube channel. But Bethany, she had a unique situation where she was born and kind of never really had the appropriate amount of teeth that she was supposed to. She had bad teeth as a kid and was actually in a denture at a very young age. Like 8 years old, she was trying to wear a denture. So we were able to actually place implants in her upper and lower jaws, which she had been told in the past that she could not have implants. because she didn't have enough bone. But the way we do things here, we could find bone, do some different procedures, and we're able to put in the implants and get her a fixed set of, implant-supported teeth. So I'm going to let her tell her story through a short little video.
I had looked into dental implants before, but I had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We're able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day, make that big of a difference in a patient's life. All right, girl, we all want to see.
Okay. Wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, obviously you definitely can. Now, thanks to Dr. Kirkpatrick, I actually feel free to smile freely and I can eat whatever I want.
Okay, so you can see Bethany's, before and after picture. The before picture doesn't look that bad, but it's a denture. She hated this. I mean, you can imagine, no one's really happy with a partial or a denture, but especially someone who's in that, middle school, high school, college age, she does not want to be going out trying to go on dates, dinner with friends with a denture. She wanted something that was more permanent, that she could be proud of and not have to worry about the thing falling out or not being able to eat what she wanted. So you can see her after, and just huge difference. Totally changed her life. We're super happy and blessed to be able to be a part of that transition with her and kind of see her through that. So why do people do the New Teeth Now procedure? Number one should be to restore total body health. This procedure is designed for people who either have, mouthful of bad teeth, mouthful of periodontal disease, where in one day we can totally eliminate the disease process, place implants, and you get the added benefit of having screwed in fixed teeth that same day. So definitely it can improve self-confidence, help patients, bring out their natural smile, increase their ability to eat the things that they want to without having to worry about pain, discomfort, teeth falling out, teeth breaking. And you're asleep during the entire procedure. So that's important. For those of you who have extreme dental phobia, and I know you're out there because we talk to patients that are, scared of the dentist, or they're in this situation because they are scared of the dentist. So that's prevented them from seeking dental help until it's, now too late and they're pushed into a corner and they need everything reconstructed. The postoperative pain level will definitely surprise you because it surprises us. We do this, quote unquote, big procedure where we're taking out all your teeth, cleaning out all the infection, putting the implants in, and putting on, teeth that same day. That's a lot to go through in one day. And I can tell you that most people go through this procedure and may take one pain pill. We give you narcotic pain medicine. I give you a couple different prescriptions. And, at the end of the day, what we're told by most of our patients, now everybody's different, but most people end up taking 1 or 2 of the narcotic pain medicine, and then they control their postoperative pain level with just Advil or Tylenol, just over the counter. So the oral body connection, one of my favorite sayings that I like to tell patients is the mouth is the gateway to a pretty awesome creation. It's the first thing that encounters the air you breathe, the food you eat, all of which you need to stay alive. And one of the big infectious processes that plays a role in your oral health is periodontal disease. And what periodontal disease does, it's a low-grade chronic infection that can be around for years and you not even know you have it. You may or may not have bleeding, swollen gums. You may or may not ever know you have it, but the longer it's there, it can start affecting other parts of your body, like your respiratory, your lungs, increases your chance respiratory diseases, increase your chance for having a COPD, exacerbation, asthma attack, digestive diseases, low preterm birth weight babies, increases your risk of diabetes, heart attack, osteoporosis, stroke. I mean, you guys can read this list, but what it all boils down to is your body is trying to fight this low-grade chronic infection. And the longer your body is fighting an infection, it doesn't matter where it's at in the body, the longer you're fighting an infection, it does reduce the effectiveness of your immune system, which can shorten your life expectancy. So it's a pretty big deal. And this is what periodontal disease looks like, real life picture. This is one of my patients. I'm gonna try to get my laser pointer working. So, if you look at this, that brown stuff that you see here, the darker yellow, that's the root of the teeth. So you can see roots. The bone has shrunk down from the periodontal disease. The gum recedes and follows it. So you can start to see some of the roots. That darker area there, that's cavities, just decay. So periodontal disease, cavities, all of these are making normal day-to-day activities difficult for this patient. Some sweets, cold, hot foods, they're very sensitive on those. It can make the teeth really sensitive, so it can hurt, be uncomfortable when they're trying to eat sweets or drink cold liquids or hot coffee. And, that's one thing. He went to see his dentist and was told that he needed to have everything taken out and dentures made. He did not want anything removable, so he came to see us. And after a consult and going through the CT scan, we're able to take all the teeth out, put in these 6 beautiful implants. And this is the same day, by the way. So you're literally taking someone in one day from this to this, which is a perfectly healthy environment with 6 solid implants on the upper jaw. This is what they look like about a couple weeks after surgery. Beautiful, healthy gum tissue with the little abutments. Those are the connectors that they attach to the implants. And then the bridge attaches to these connectors. And that enables him to look like this. So before, after, beautiful teeth, fixed, nothing removable, nothing covering the roof of the mouth, nothing, no wings up and underneath the cheeks or the lips, just can totally change his life in one day where he doesn't have to worry about his teeth hurting and what he's going to eat when he goes out with his friends for dinner. So if you want to be truly healthy, you must think about your mouth and restore your oral health. So who's a candidate for this procedure? If you have no teeth or you're unhappy with your dentures, you're definitely a candidate. If you have a mouthful of bad teeth or a mouthful of periodontal disease, then I would urge you to call me and come in for a consult. At least just let us go through your CT scan and oral exam and tell your options. It'd be well worth your time to come in and talk to me. And especially if you're on here tonight and you've ever been told by another dentist, another oral surgeon, periodontist, anybody in the dental world that you don't have enough bone for implants and you need dentures or partials or significant bone grafting, you need to come see me. I've yet to have a patient since I've been here in practice since June of 2007. So for the last 14 years, a little over 14 years, I've not had a patient that I couldn't do this procedure on because they didn't have enough bone. And we do these every day. So another one of my patients, before picture, you can see he's got a lot going on. The little dark spot that you see on his gum there, that's infection that's actually draining from the tooth through the bone, eating its way through the gum and draining into his mouth. You can't fix that without taking the tooth out. There's no treatment. Antibiotics will knock it down for a week, but as soon as you stop taking the antibiotics, it'll come right back. He's got periodontal disease, decay, malalignment of teeth. He's got spaces in between his teeth. And this is him after. This man was told that he didn't have enough bone or because of his infection and he couldn't have dentures. And that is his after when he left us. And that, well, to be fair to this picture, that's about 6 weeks after his procedure. So you can see he's pretty much healed from the surgical recovery part. He's still recovering and letting the bone fuse to the implants, which does take about 6 months for that entire process to complete. But look at him. That's a totally different person. He had a really outgoing personality before we did the procedure, and now that he doesn't have to think about or be self-conscious about his teeth, totally changed the game for him. This young lady, same thing. Been told by several different providers that she was not a candidate for implants because she didn't have enough bone. She'd been in a denture for years. She wanted to, she hated the denture, wanted to get rid of the denture. So she came in to see me to see if she was a candidate for implants. She was. We were able to put the implants in, fixed, bridge on in one day, and throw her dentures away that same day. Another patient. This patient's a little different. Had a denture on the top for years, had a lower implant retained denture on the bottom. So you can see the two implants here. She had not really a partial, but it was like a full denture that snapped onto these implants, still removable. Still, she needed to take it out and clean it. And really, you're not supposed to sleep in a denture or an implant-supported denture. But so she's supposed to take it out at night, set it in a denture cup by the bedside, and then get up and clean it, put it back in her mouth the next morning. She'd been wearing that for years. It started to fail. The implants down here started to fail because the more times that you're trying to snap a denture on and off implants, they can wear out. Where if they're fixed to the implants, you're not really taking or snapping anything on and off the implants. So they remain more stable. She was told that there's no way that she could have implants, especially in her upper jaw, because she did not have enough bone for implants. Well, that's where one of the procedures that we do here at New Teeth Now comes into play, called the zygomatic implants. So zygomatic implants are designed for people who do not have a lot of bone in the back part of the upper jaw, or for that matter, anywhere in the upper jaw. We can anchor these, bypass the place that you are missing bone, anchor them into the lower part of your cheekbone, and get tremendous support where we can still do these bridges without bone grafting and still do it in one day. And before I go on to the next patient, I just sort of remind everybody what Bianca did say at the beginning of the presentation, that if you have any questions, make sure you submit those, and we'll stop and entertain those questions, and I'll answer those live here on the webinar. And actually, Bianca,
we actually do have
a message that I see.
Yeah.
That we do have a question. I think now's a good time to take that.
Yes, so we actually have a question regarding zygomatic implants, so it's perfect. So this person asked, what does recovery look like with zygomatic implants?
That's a great question. So the recovery actually will probably surprise you. It's almost exactly the same as if you had traditional implants. You may get a little bruising underneath your eye, but you still, with this procedure, the thing that I guess would make the recovery worse for some patients is usually the extractions, taking the teeth out, which really has nothing to do with the implants or whether you have zygomatic implants or not. Taking the teeth out are usually what initially the recovery would be the worst from. The zygomatic implants, it's a regular implant. They're just a little longer and they anchor into the lower part of the cheekbone instead of the back part of the upper jaw. So the recovery is about the same. I mean, you may have a little more bruising kind of in this area, just at the lower eyelid area, but other than that, exactly the same. But that's a good question. We get that a lot, actually. And Bianca, feel free to interrupt me anytime we have a question. So if I'm not really paying attention to the alert on my phone,
sure.
we'll get those.
I actually had one come in right now, if you don't mind answering that one.
Yeah, perfect. We'll go.
Is new teeth now considered implant-supported dentures?
No, absolutely not. So implant-supported dentures are still a denture. It's something that needs to be removed. It needs to be cleaned. So let me back up. The basics of what we do versus like an implant-supported denture or regular denture. Any type of denture needs to be supported with either your gums, so it's resting on the gums, or it's snapped onto a few implants and still resting on the gums. So every time you chew, think about this. You chew something that's kind of chewy or hard. The harder you bite down on a denture or an implant-supported denture, the more pressure gets translated to your gums, okay? With the New Teeth Now procedure, it's instead of like an implant-retained denture, it's more like a fixed bridge. The only thing supporting that bridge with our New Teeth Now procedure are the implants. It makes no difference where your gum is. There's no pressure on the gums. We do make the bridge to go up and just touch the gums, but it's not supported with the gums. It's purely supported on the implants, you can't take it out. Only us or a dentist well-trained with implants can take these things out. So there's a huge difference between a denture, an implant-supported denture, and the New Teeth Now procedure. One of the things that I like to tell patients is, we don't have anything that's as good as your natural teeth. No one does. But we've got something that's the closest thing you can get to having your natural teeth back. And that's the New Teeth Now procedure supported on implants. So let me go back to this patient. And yeah, Bianca, another great question. Just keep them coming as they come in. So this lady, and we have patients that come in from different countries. Actually, we have patients from every state except North Dakota. So if you're on here from North Dakota, definitely try to schedule a consult. I would love to see you so we can claim that we've got someone from all 50 states. But, saying that, we do have patients that come from all over the place to come in for this specific procedure because we do a lot of the zygomatic implants. We do more than anywhere in the world. I mean, it's just a volume thing that we do this every day. And we see a lot of people that come in because they need help, because they don't have a lot of bone. So they come for the zygomatic implants. Like this lady, she came from the northeastern part of the United States. So she's around the New York, Philadelphia area. She knew she needed zygomas. She had been here for a consult. She went back home, tried to find somebody there that could do the zygomatic implants. There was no one. People advertised that we do zygomatic implants, or they advertise about zygomatic implants. But when she really went into actually, now it's real and I need the procedure done, can you do it? They couldn't do it. So she came here for the procedure. We took that out. The teeth don't look that bad. That's one huge bridge on her natural teeth that was failing. You could literally take that and move it up and down. It was about to come out at any time. So we did take it out when she was asleep, and I put in 4 traditional implants, 2 in the front, 2 in the middle, and then the zygomatic implants in the back. And that enabled her to get a fixed implant bridge. That's her after picture. Beautiful teeth. So happy, loved them. She went back home with teeth screwed into her implants in areas that she was told she couldn't have implants. So that's one of the beautiful things about the New Teeth Now procedure, is that we can take a patient who's been told you're not a candidate, or hey, you need zygomatic implants, but we can't do those. We can do those. And here is a 3-dimensional video of what the zygomatic implants actually look like on a real skull. So you can see as they rotate the skull, these are the zygomatic implants. The actual implant looks a little different than that. That looks more like a screw. But you can see bridge screwed in to those 66 implants. So those implants give patients tremendous support in areas that otherwise they either are not an implant candidate, cannot get implants, or they would need some type of, some serious bone grafting. And we used to do those. I mean, I did a lot of those in residency where we would take bone from patients' hips or the lower part of the leg and put in the upper jaw or lower jaw so patients could be an implant candidate. Now we don't have to do that. That's kind of the old way of doing things. When we can bypass that, not do the bone grafting, put in zygomatic implants and anchor them into bone that the patient has grown and developed with throughout their life, instead of bone I've tried to graft and make you grow in a certain place, it's always stronger. And this is about as serious as it can get with bone loss. So before, significant amount of bone. Here, the little thin white line that you see there, that's the sinus cavity. And you've got the sinus on the other side. This dark area is inside your nose. And then that's the amount of bone. There's very little there. You need around 10 millimeters of bone height for an implant, for a traditional implant. This patient probably had at most anywhere was 6 or 7. Not a problem with zygomatic implants. You can see 4 zygomatic implants. We call it a quad zygomatic implant case. And I was actually able to find a little bit of bone to put a traditional 10 millimeter implant right there, just as a bonus implant. Patient didn't really need it, but if you've got bone and I can use it, I'm gonna try to give you as much support as I can. So another part of my practice is facial cosmetics. And, I'm gonna briefly touch on this, but it's something that, patients come in and once they realize that I do that as well, or that we can do that here in the office, I mean, you can literally go to sleep and have your entire mouth reconstructed and a CO2 laser resurfacing on your face. And I'll show you some before and afters of that. But part of my practice, chin and cheek implants, brow lifts, eyelid surgery, facelift, neck lift, neck liposuction, lip lift, which is a really cool procedure to add on to one of these hybrids, and rhinoplasty. So here's a patient. She came in for the New Teeth Now procedure. She had been to a lot of other places that had told her she really wanted a candidate for implants. She came in, figured out, of course, she's a candidate for the New Teeth Now procedure. And she saw one of my brochures and she was like, so do you have anything that I could get rid of these kind of the dark sunspots and these fine lines and wrinkles? And I'm like, actually, we can do a CO2 laser. We can do it the same time we do your teeth. So she came in for a procedure. She went under general anesthesia, took out all of her teeth, cleaned all the infection out, put in the implants, and did a CO2 laser resurfacing of her face. This is about 3 weeks after her procedure. And you can see this after looks like this before younger sister. So almost, not all of the sunspots are gone, but most of them are gone. And all the little fine lines and wrinkles, they're not gone, but they are dramatically improved. Just a huge, huge difference for her. Facelift, if you look at the corners of the mouth, the jawline, the neck, a lot more smooth, more defined jawline. Another facelift and a neck lift with liposuction. Big difference in the jowls, the jawline, the neck. You can see like the wrinkles here that are gone here. I actually did a brow lift on her as well. This patient, simple chin implant, takes about 45 minutes, but makes a huge difference. You can see here that those little dimpling areas, the stippling in the skin on the chin, that's where she's trying to forcefully contract that mentalis muscle to try to get her chin and her lips in the right place, put in the chin implant, dramatic difference of the jawline, and then there's no more strain on that muscle. So the New Teeth Now procedure, one thing that I do get asked occasionally, not a lot, but occasionally, well, once I get these implants put in, am I ever going to need a root canal in the future? No, because the teeth are gone. And you can't do a root canal on an implant because there's no canal inside the implant. And then they will never decay. And you can see, the before and after, I really like this before and after. Just got a really nice result. And they are very easy to maintain. You brush them, toothbrush, toothpaste, go see your general dentist, every 6 months and have your cleanings. That we try to make it as easy as we can, for the procedure and the maintenance, and it really can't get any easier than that if you're the patient.
So we had a couple questions come
toothbrush and
in.
toothpaste. Yeah, perfect.
Sorry to jump in here. Just want to get them asked. So the first one is, are these teeth considered forever teeth, or do they need to be changed after a few years?
Really good question. Okay, so there's a couple different parts to that answer, and hopefully I'll get exactly what you were looking for. But so the implants, once they go in and they fuse to your bone, which takes the 6 months, those things are designed to be there forever. That's your support system. That's your foundation that your bridge is built on. The teeth themselves, the way we used to do this is your final teeth were made out of acrylic, and the years that they would last would depend on how well you cared for them. But somewhere between 7 and 10 years, the lab or your restorative doctor would need to do what they call a retread. Think of it the same way that you would do for a truck tire. The tire's still there, but you're putting new tread on the outside. With these teeth, they strip the old worn out teeth off, put new teeth on. That's the way it used to be done. Now zirconia came in to play. Zirconia is a totally different game. Been around, we've been doing it since about the end of 2009, 2010 timeframe. And zirconia, the people who came up with the idea of being able to make a full arch bridge out of zirconia, marketed it as forever teeth. They're never going to break. You can't break them. They're never going to wear down. They're partly true. So can they break? It's possible to break zirconia. It's difficult, but it's possible. You get these things put in, you go get in a car wreck, you hit the steering wheel, you can break your bridge. It may break. It may not, but it can break. But what we're seeing is, since we've been doing this since the end of 2009, 2010, hardly anywhere do we know how long they're going to last. The honest answer is no. They've only been out since then, so about 13, 14 years. We know they've lasted that long with hardly anywhere, but we don't know how long they're going to last. They're designed to last you forever. It's just no one's had them that long to be able to know. But that's a good question.
So our second question, do you have comments from patients who have maybe only had a few teeth for a long time, like maybe someone who has a lot of missing teeth, what it feels like for them to have the full bridges in?
Yeah, that's, there's always the time frame for people to get used to these teeth, used to the feel. And that's, it's like it's a learning curve. And what happens is we're changing everything inside your mouth. It doesn't really matter what you started with. If you had no teeth and dentures, we're putting implants in and we're putting a fixed bridge in that's a different feel than what you had with a denture or no teeth. If you had a few teeth here and there, couple teeth on the upper right, a couple teeth on the lower left, and now all of a sudden we gave you a mouthful of teeth, yeah, it's going to feel different. For sure, it's going to feel different. And if you go from natural teeth to the New Teeth Now procedure with the fixed bridges on implants, definitely it's going to be different. They're not exactly the same size. They're a certain thickness of a full horseshoe-shaped bridge that's screwed into the implants. So there is the little learning curve. And what I always tell patients in the consults, when I'm sitting going over your scan, your exam, and going through answering any questions you have, what I tell patients for your expectations, once we do this procedure, I don't really even want you to try to even critique it or even complain about how they feel for about 8 to 10 weeks, because that's the time frame that most patients tell us, or that we'll be seeing, because we see you quite often for post-operative appointments, and it's usually around that time frame, about 2.5 months after the procedure, patients start to say, yeah, I don't really think about them anymore. They just feel like they're a part of me. Well, the reason for that is because they can't come in and out. So you can really never part ways with them. So they're always there, and you're kind of forced to get used to them. And I haven't had a patient yet tell me that, at the end of the day, when it's time to get their final teeth in, which I'm going to talk about in a second, 6 months later, no one complains about the way they feel, or, gosh, I'm just not used to them, or it feels like there's too much stuff in my mouth, no matter what they started with. But almost every patient says something about it, the first or second post-operative appointment. So that first 4 to 6 weeks after surgery, everybody's thinking about it. Everybody's kind of like, yeah, I'm still getting used to them. It's different, but you do get used to them. And they really start, another cool part of that is every 6 months when you go in for your cleanings, a restorative team takes the teeth out. That's as easy as it can be. You don't have to sit there to let them scrape on the teeth to clean them. They unscrew them, take them out, take them in the back to the lab, put them in an ultrasonic cleaner, clean them, steam clean them to get any stains that accumulated from, just like natural teeth, whatever stains natural teeth will stain these. Coffee, wine, red wine, smoking, anything that would stain your natural teeth will stain these. So they steam clean them, get all the stains off, put them back in. But where I was going with that, at that appointment, when those teeth are out and the patient's sitting there for 15, 20 minutes while they're in the back getting cleaned, while the teeth are out of their mouth, you can see them. They're like, okay, how much longer? How much longer till you can get my teeth back in? Because I hate this feeling without my teeth in. I want my teeth back in. And that's a good thing, because that tells us you got used to the teeth and you like the feeling of them being in, and it feels really weird without them. Instead of during the initial post-operative visit where it feels really weird with them, it feels really weird without them once you get used to them. Any other questions, Bianca?
Yes. So this person asked, do you tackle implant fails?
Yes, we do. I hate to see any patient with any implant problems, but, there's nothing in life in general, but especially in the medical dental world, that's 100% successful. Implants are very successful, around 90%. But occasionally there will be an implant fail. Thankfully, we are on the upper side of the success rate of implants. And I think a lot of that has to do with just the technique that we use. And, we take our time, we make sure everything's properly done surgically, and we make sure that you're doing your part afterwards, keeping everything clean. But if an implant fails, definitely we tackle that. And we see, unfortunately, a lot of patients who have traveled to, another country. I've seen a patient from the country of Colombia. I've seen multiple patients from Costa Rica. I've seen some patients from Mexico. I've seen some patients from here in the United States that have had implant disasters. And they come in, and yes, we can tackle those, where we would go through the CT scan and talk to you about anything that we would need to do or help out to get rid of the failed implants, clean everything up, and put new implants in. So yes, we do that.
And we have one more question. So,
Okay.
Do the teeth impact the way you speak?
Another good question, and that plays on the time frame that I was saying. There's that learning curve to get used to the feel, the sensation of the teeth on the inside of the mouth. Yeah, I would tell you it's going to take that long for you to get used to the feeling, used to where your tongue needs to go to seal certain areas to create, certain syllables, especially certain letters such as R, S, T, L, N, anything where your tongue goes to the front part or the back part of your upper front teeth to make it T, T. So, you can, 90% of the patients come in, you can see them even at their very first postoperative visit, they're flying through it. They're not having any trouble. Their speech, no problem. The other 10%, you can tell that they're really trying to pay attention to what they're saying, where their tongue is going. They're trying to pronounce things, they're focused on that. And what we tell patients to do, that if you are having a little trouble with that, or you feel like that you're having trouble with speech, sit in front of a mirror and talk to yourself. Read a book. Go through and read social media on your phone or your computer in front of a mirror. Practice. I said that, a few patients come in during that initial time frame where they're still getting used to the teeth and, have a comment or two about the speech. But at the end of the 6 months, when you're getting your final teeth made, that kind of goes away. We really don't hear a lot of people complaining about the speech at that point because you kind of get used to it. You adapt to it. But occasionally we do. So Bianca, stop me if there's any other questions, but I'm going to go over these differentiators.
Sounds good.
So there's basically, when you go in anywhere for consult for this type of procedure, here are really 6 things that you need to take home from tonight's presentation. Because I think all 6 of these differentiate us from a lot of other people that try to do the same procedure. Number 1, we're all board certified. We're board certified. We're held to the highest standard of all the surgeons in our specialty. We have a super experienced team. The office has been doing this procedure for about 35 years. I've been here since June of 2007. And since then, I would say there were some significant changes when zirconia came around in 2010. Then the more of the zygomatic implants that we've been doing, which we do a lot of those, our whole office is kind of geared toward this. So everyone is super educated on the entire process, from the people that you talk to on the phone when you call to schedule your consult, to the people at the front desk, the people that help check you in, the implant coordinators. I mean, they know so much about this procedure that sometimes I'll walk into the consult after you've talked to the implant coordinator for 20, 30 minutes, and it's almost like that I'm just repeating everything they've told you, and which to me is awesome because I'm just confirming it. And you feel comfortable about what they told you when I'm backing it up by telling you the same thing. So very experienced team. You're under general anesthesia. You're totally asleep, just like any other outpatient surgical procedure. You have a breathing tube placed. We control your airway, which is the safest way to do this. And you're not under sedation. We're not trying to fuss and fight with you under an IV sedation. You're totally asleep under general anesthesia with their experienced anesthesia team. everything is under one roof. You don't come here for the surgery, go somewhere else for the, to get impressions made, go to a lab down the street, or your teeth be sent off to a lab in China or California or who knows where. Everything is here. The surgery's here, the recovery's here, the post-op visits are here, the restorative team is here, the lab is here. Everything is under one roof. We have the zygomatic implants. Like I said earlier, I feel very confident in saying that we do more here in this office than anywhere in the United States, probably anywhere in the world. And I would even go as far to say that you could probably put the next 2 clinics that are under us with zygomatic implants, add theirs together, and they still don't do the numbers that we do. And then your final teeth is zirconia. You really need to know all 6 of these bullet points if you choose to go somewhere else for a consult, because I doubt that they have even 2 of these at another clinic, much less all 6. So the all under one roof, the consult, the impressions, the surgery, the lab, the final teeth, everything is done here. All in one day. The procedure's done in just one day. Your temporary teeth are acrylic. So those are the teeth that I put on the day of surgery when we do the procedure. You wear those for 6 months while the implants are fusing with your bone. And, we like to call those your test drive set. So if there's anything you want to change going from your temporaries to the finals, you can. You're not locked into what you picked to be what you thought you wanted your teeth to look like for your temporary teeth. You can change anything you want going from your temporary to your final. And then the final teeth are made out of zirconia. The consultation, when you come in, first thing we do, we go over your health history. We get a CAT scan, and we use that to help develop a treatment plan. And our implant coordinators go over, your treatment plan and the logistics of the scheduling and everything we need before, certain appointments. Speaking of our implant coordinators, here they are: Shauna, Debbie, Mara, all super experienced, very nice young ladies, very compassionate and understanding with, that patients come in all kind of different situations and backgrounds, and why a certain patient is in the condition that they're in and need the New Teeth Now procedure. It's something that they try to make you feel as comfortable as they can, because they know that you're really taking a big step coming here for not only the consult, but for the procedure. And, we want to try to make it as easy as we can for everyone, for all the patients. The restorative team, Dr. Nafala, Dr. Dibbs, and Dr. Sorrento. I can't really explain how important it is having the restorative team here that, I can bounce questions off of from us, coming from the surgical side, asking them about the restorative side, and likewise with them coming to me and be like, hey, on this patient that you saw for a consult, I'm seeing them for their impressions. We're picking out what they want their teeth to look like. Do you think you can get an implant or angle them in certain positions? So yeah, that is invaluable to get to a final product that's as good as it can be. And, I'm gonna let Dr. Dibbs, who is one of the restorative dentists that you see there in the middle, he's going to talk to you about his experience and why it's so important, because he's been with us since about 2012, so about 10 years. 12, I think it was 2012 when he got here, but he's been with us, around 10 years. And he would, like everyone else, most people don't have everything under one roof. So when he came here, it was almost surreal to him. And he still brags on, all the advantages of having everything here under one roof. And I'm gonna let him kind of walk you through that.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
All right, so, I think Dr. Dibbs does a really nice job of talking about the importance of what I've reiterated multiple times during this presentation. Everything's under one roof. When you have everyone here that can look at you at almost the same time, from me as the surgeon, Dr. Richards as the surgeon, any of our restorative team, and the lab, and our anesthesia team, it's going to make it as safe as possible for every patient. And it's going to make, at the end of the day, we can give you the best product that we can give. And it really doesn't get much better than that for the patient. Here is, obviously, there's me and my surgical staff. And the one thing I'll say about this place, it's a very big building. We have a lot of employees. We've got about 50 people that work in the building. And it takes the entire team to get the process completed and everything done for every patient. But like with me in particular, me and my surgical staff, when you come in, if I'm the one that's treating you, you're going to get to definitely know me. And all three of these, Amanda, Corey, and Monica, they've been with me for a long time. They know this procedure in and out. I always joke around with them that they've been a part of these procedures for so long that they could probably just switch places with me and literally put the implants in. They've seen so many and assisted on some of these. It's really nice to have people that know not only what to do, but they almost think ahead and they know my next move. So whenever I'm getting ready to either change an instrument, they already have it in their hand ready to hand it to me because they've seen me in certain situations so many times that they know what I'm going to do next, or they know what I'm going to use next. And that's important. Our anesthesia team, this is the two main part of our anesthesia team, Jack Daniels and Kim Cherry. I mean, come on, who better to put you to sleep than Jack Daniels, And, but you can see they've got lots of years of experience. Both have worked hospital settings, cardiac care, doing all kind of anesthesia in a true hospital setting. Very experienced, very good at what they do, very safe with what they do. Here's our entire team. And it takes every one of these people to make this machine work and work well, from the marketing side to the administrative side to to the restorative side, the lab, everyone here. It takes everyone, on the team to make it successful. I'm going to end with one last patient, and he's kind of special patient to me. He traveled in from another state, and one of the things that we do for out-of-state patients is on our website. It kind of goes through and walks you through the transformation vacation, and that's what we can do, where we can help you get set up with travel, hotel, transportation from the hotel to our office and back, and make sure that we have all the appropriate paperwork that we need, which would include maybe lab work and an EKG before you come down. Because if we're trying to set it up to where we make it super convenient and where appointments are kind of stacked on each other, it makes it pretty nice for out-of-state patients, one of which is Juan. And I'm going to let him kind of go through his, sorry, I started that too early. I'm going to let him go through his experience with us here, and then we'll talk about him afterwards.
I am different. I was born different. My adult teeth weren't growing in. And when I went to the dentist said that it was partial endodontia. You become extremely self-conscious. You're always looking down, looking away. You can't hold a conversation more than maybe 2 minutes before somebody looks you in the mouth, and it's always that stare, and they can't help it. It hurts. It's very hurtful. I'm 35 years of age and waiting my entire life to find a procedure. I finally found it, and it gave me the opportunity to change my life.
Oh boy.
See that?
Oh my goodness.
I thought it would be good, but this is phenomenal. The staff, you feel like family. Everyone here knows you on a first name basis. This is more than I could have ever imagined. Now, it's the confidence of speaking to someone and having conversations and, not having to look around to see if someone's staring at me, and just looking in someone's eyes and seeing them look you in your eyes is an unreal feeling. On my airplane ride here yesterday, I had a long conversation with an individual that was sitting right next to me who also was from Chicago. Then the lady in the aisle joined in on the conversation. I realized the entire time that I was looking at them both. They were looking me in my eyes, and we were having a whole conversation for about an hour, and I would have never done that in the past. One of the ladies said, "You have such a beautiful smile." To me, it's a whole new world. I had a really good feeling that everything was going to turn out in my favor, and it did. I know every day I'm going to smile as big as I can for no reason because of new teeth now.
You can tell, you can look at his before picture and then look at his after. And by the way, this after picture is different from the picture at the end of his video, which I'm not going to run through that again, but this is taken the same, these two pictures taken the same day. Okay. He came in, that's what he looked like in the morning. This is what he looked like leaving. That is a huge difference to be able to do for this young man in one day. So here's the process. First step, come in for a consult. During the consult, we obtain the CT scan. We go over your specific situation, your treatment plan, the steps coming up for the next appointments. The next appointment would be pre-op and impressions. What that means is you come in, we make sure all the paperwork's completed. We got any blood work, lab work, medical clearances, anything that you would need on the medical side to make it safe for the surgery and the anesthesia. And we get impressions. That's when you meet with our restorative team and they take impressions, talk to you about what you want your teeth to look like. Next appointment is the new teeth now procedure. That's when it happens. That's when the magic happens. You come in, we start usually around 7:30 in the morning. You go to sleep. I do what I need to do by taking, if you have teeth, take them out. If you don't have teeth, we just start with the implants, clean everything, make sure everything's nice and smooth, put the implants in, take impressions with your temporary teeth that we had pre-made during this appointment. And at the end of the day, I put those teeth in for you. They're custom fit, they're custom made. Everything is totally specific for every individual patient. Then you go home. You go home with a mouthful of screwed in teeth. You can go home and eat dinner that night using your teeth. Yes, we do restrict your diet. For the first 6 months until your bone has fused with those implants, you're on somewhat of a soft diet. My rule of thumb, you don't have to ask me, can I have this? Should I eat this? Should I not eat this? If you can easily cut it with a fork, you can have it. Easily cut it with a fork, you can have it. Then you come in for your post-op appointments, any adjustments. We constantly are checking to make sure that when you open and close your mouth, that the teeth are fitting pretty even and hitting on both sides, on the right and left side evenly. And if they're not, we adjust them quick and easy. Then you come in, we start making your final teeth, and then we place your final teeth. We start making them at approximately 5.5 to 6 months after surgery, and it usually takes about 3 appointments with a total time of about 6 to 8 weeks to make the teeth, because they're made from scratch. You know, people say, well, what do you mean I just don't get my final teeth in 6 months? No, there's a huge process to make the zirconia, and it has to be perfect. If it's not perfect, they will not fit. Have we ever had any that don't fit? Hardly ever. So we go through the proper steps to make sure that everything is in place, everything's made correctly, processed correctly, inserted to where you're super happy at the end of the day. And then what's left? Care and maintenance. Every 6 months, go in for your routine cleanings. So the resources that we have here at our office, I'm gonna let Bianca kind of take it from here and go through that. And then Bianca, now's a great time to answer any remaining questions.
Yeah, so we had one more remaining question. And this person asked, is the fake gum that is used for the bridge noticeable to people when they look at you or when you smile?
No, on the zirconia, we want that gum to be as real looking as possible. So when you smile, the reason you've got that fake gum there is because usually if patients have bad teeth, periodontal disease, or missing teeth, their gum is shrank. So if you try to put just teeth there, it's going to look terrible. You're going to see where the gum does not go in and fit, and make the little pink triangles in between your teeth, like what a healthy mouth would look like. It would look terrible. So we add the pink colored zirconia, which makes these teeth look great from day one through, as what I said earlier, zirconia has been around for about 13, 14 years. It still looks great. So it will always look good, and that gum's not going to shrink from the teeth because it's fake. So yeah, it looks really natural.
We do have our YouTube channel. We're always posting new content, lots of question and answer videos. All of our webinars are on there, different patient testimonials. So it's definitely a good resource to learn more about the procedure. And we also have our social media channels. We're always posting updates on there as well. You can message us on our YouTube or Facebook or Instagram with questions. So really that's just another way to educate and feel informed to make the decision that's best for you. So we really just thank everyone for being here tonight. If you have joined us for the entire webinar, this is a procedure that you probably need, and so we're just really glad that you are here with us, asking great questions. And if you do have more questions or are ready to set up a consult, please give us a call tomorrow. We are so excited to talk with you. You would be in great hands with Dr. Kirkpatrick, and we would love to be part of an amazing transformation for your smile, your health, your happiness, your whole life. Thank you, everyone. Have a wonderful evening.